Hi everyone, this is Dr. Robin Lewis. I'm a naturopathic physician practicing here in Vancouver, British Columbia, Canada. And today I want to talk to you about exercise and the heart. So have you ever wondered what type of exercise is best for the heart? Have you ever wondered, should you do cardio or should you do resistance training? How much of either? Or is there a risk when it comes to exercise? Is there anything that you need to be worried about? If these are questions that you've been asking yourself, today's episode is for you. This episode is for anyone who is looking to either prevent heart disease or for those of you who already have advanced heart disease or are recovering from things like heart attack and stroke. So this episode is a catch-all for everybody. The thing about exercise is it's an incredible tool. You just need to know how to use it properly. Many of my heart patients have asked me what exercise is best because they're genuinely concerned about the risk associated with certain types of exercise. And I mean, it makes sense. It's coming from a genuine place because exercise does increase your blood pressure, increase your heart rate, increase how heavy you're breathing. And outside of the context of exercise, those are generally considered not great things. So it's really about educating people to understand how, even though these are technically stressors on the heart and the cardiovascular system, it's the reflexive adaptation that happens after exercise that makes it beneficial. So it's what's considered a good stress on the heart for the most part. The beneficial adaptations that happen as a product of exercise are things like a decrease in your blood pressure, a decrease in your heart rate. We're talking about your resting heart rate going down. So yes, these sort of things get elevated during exercise itself, but once you come back down after exercise, you will notice improvements in these areas. You will also notice that your heart contractility is better. So your heart is pumping more efficiently. The stroke volume, so the amount of blood per pump, will also improve. And the size of the heart can also increase in response to things like heavy amounts of exercise. So generally speaking, all of these things are considered good things. So no matter how you shake it, the benefits of exercise far outweigh the consequences or the risk. That being said, in today's video, I'm going to break it down for you when it comes to cardio versus resistance or strength training. So how are these two types of exercise different? How do they have different effects on the cardiovascular system? And how can you do a balanced amount of both so that you improve your odds of living a healthy, long life? So let's start by talking about resistance training. So there's many different benefits, but from a cardiovascular perspective, one of the main benefits of strength training is that it builds muscle. Now, muscles in of themselves, aesthetically pleasing, yes, but more importantly, they act as mops for sugar. So the more muscle you have, the better your metabolism and the more easily you dispose of sugar. Now, what does this have to do with the heart? Well, chronically elevated blood sugars, like we see in people with prediabetes, full-on diabetes, blood sugar issues, those elevated sugars are very damaging to the blood vessels. And the more we damage our blood vessels, the more plaque we build up inside of those blood vessels. And of course, as you can imagine, the more plaque that builds up around those blood vessel walls, the narrower and narrower the space to deliver things like oxygen and nutrients to our heart muscle, but also to the rest of our body. So we want blood sugars to be nice and regulated so they don't beat up our blood vessel wall lining and so that we don't develop plaque, narrowing of arteries, and everything can get as much oxygen and nutrients as possible so everything works better. So without getting into crazy amounts of detail, it is very important to put some muscle on your body. And of course, strength training is one of the main mechanisms of doing that. Now let's move on to cardio. It's a little bit more controversial than resistance training, so there are some risks associated with high volumes of it. But for now, I'm going to talk more about the benefits. When it comes to cardio or aerobic training, anaerobic training, going for runs, things like that, I really like what's called zone 2 training for the heart. So zone 2 is true aerobic cardio. So this is a type of cardio where you can still kind of chat with someone. Yeah, you're working hard, but it's not like sprints or anything like that where you're completely breathless. And from a tissue standpoint, it's when your body is using the max amount of oxygen before it starts to run low on oxygen and your metabolism starts to shift. So basically, it's the earlier stages of cardio where your tissues still have high amounts of oxygen. So why do I care about zone 2 training? What's so special about it? Well, if you do enough zone 2 training, it increases the number of mitochondria in your heart. Now, the mitochondria is the part of the cell that makes energy. So for obvious reasons, we want a lot of mitochondria. We want a lot of energy so that our heart can do what it wants to do more effectively. When you're training in zone 2, it maximizes that mitochondrial output. The more you do it, the more your body's going to cue in and realize it needs to produce more mitochondria to keep up with this. When you do beyond zone 2 training, it switches you into a different metabolic state because now your tissues don't have as much oxygen as they did before. They can't keep up, so they use a different type of metabolism to get energy. So it doesn't maximize your mitochondria as much. So zone 2 is really that sweet spot where you're getting your mitochondria to pump more and more and more energy out to meet up with those demands. And eventually, over a period of time, your body will adapt and produce more mitochondria. And your heart is one of the most dense in mitochondria. So it's really important for your heart to have fully functioning and numerous amounts of mitochondria so that it can keep working well. So that is why I really love zone 2 training. Now, the best way to know whether or not you're in zone 2 training is to do some form of formal exercise testing so they can give you the exact heart rate in which you're in zone 2. So I've done this personally through something called Pnoe testing, where they hook you up to a mask that measures the gas that you breathe out, the rate at which you breathe these things out, and then I'm on the bicycle trying to work hard, getting walked through these different stages of cardio. Not everyone has access to these sort of tests. They can get expensive, and the gold standard is like more of a lab setting kind of measurement. But for those of us who don't have access to these types of resources, you can do a rough approximation through just calculations. So the rough formula to calculate your zone 2 training is 220 minus your age. So say you're 30 like myself, that means 220 minus 30 gives you 190. Now that's your maximum heart rate. Zone 2 is 70 to 80% of that. So I'm looking to have my heart rate roughly around 130 to 150 beats per minute if I'm in zone 2 and using this calculator. So that's a very rough way of approximating your zone 2 type of training. And for a lot of people, that might just be all that you can do for now. If you want to take it up a notch, you can do these more advanced testing where they tell you exactly. But for now, it's a good place to start. Of course, to see this adaptation, you do need to do a significant volume of zone 2 training. Your body isn't going to just adapt overnight. So the goal for zone 2 training is to get roughly 3 to 4 hours of it a week. And you want those sessions, each session of cardio in zone 2, to be at least 45 minutes long. So of course you could play around with how many sessions you do, and this is the end goal. So most of us aren't starting at that place. That's something to work up to, so be kind to yourself. But if you want to get the maximal benefit out of zone 2 training, that is the type of volume that you're looking at. So that is, in a nutshell, one of the main benefits of cardio. If you can do zone 2 training, it's not the only type of cardio out there. It's not the only thing that's beneficial, but it's certainly a really safe and effective way to improve your heart function. So now that we've covered some of the benefits of the 2 different types of exercise, let's dive into some of the risk. So, like anything, you can have too much of a good thing. So extreme exercise can actually end up being more of a burden on the heart than a benefit. This is why we'll see certain cases of like ultra marathoners just all of a sudden dropping of a heart attack. Of course, we idolize these people in our society. We think, wow, they're accomplishing such incredible feats. They're running such crazy distances. They're doing these things that we've never done before. But there is a difference between exercising for fitness, for goals, versus exercising for longevity. So sometimes these athletes are taking it too far and you're actually burdening the system. Yes, they might look incredibly fit on the outside, but what's going on internally is not as great. If we look at the 2 different types of exercise, so weight training versus cardio or aerobic training, there are 2 different types of stresses on the heart. And I will say, generally speaking, it's the cardio that actually tends to have a little bit of a higher risk. And this is because cardio is technically a volume overload of the heart. So what I mean by this is your body has to really ramp up the volume of blood that it's pumping per minute. So you go from pumping about 4 to 6 liters a minute, which is still a lot of blood. So you at rest are pumping about 4 to 6 liters a minute. When you exercise, that can go from 25 to 35 liters a minute. So this is a big change on the system. And of course, if you're doing extreme amounts of cardio, that's a lot of demand on the heart. Now imagine you're that ultra marathon runner where you have to pump about 35 liters of blood a minute for hours on end. Eventually, your body is going to switch from aerobic to anaerobic cardio. So basically, you will be huffing and puffing, and eventually the oxygen getting to the tissues, getting to the heart, getting to the muscles will start to get lower and lower. And that's when you start to build up something called lactic acid. So I'm sure all of us can relate to going to the gym, maybe if we haven't been for a little while, and you feel very sore the next day. That's usually lactic acid built up in the body. Your tissue is not used to that much demand, and so it very quickly switches into a different type of metabolism that will build up more lactic acid. The issue is your heart is also a muscle. So it too can build up lactic acid, especially in these really long endurance runners or rowers or someone who does a lot of cardio. You can build up lactic acid in the heart tissue. And certainly if you're not taking recovery days, your body won't be able to flush it out as well. Your body won't be able to flush it out as quickly as it builds up. And that lactic acid can lead to damage in the heart. So it can kind of scar up the heart and things like that. Of course, again, I'm talking about more extreme versions of exercise, but it's important to understand nonetheless. The lactic acid can build up, it can create damage in the heart, and this is usually being seen with more cardio-based, endurance-based exercise. More specifically, this type of damage to the heart can lead to things like atrial fibrillation, which is a rhythm disorder of the heart. So it's when your heartbeat is irregular and a little too fast. And people who do extreme amounts of cardio are about 5 times the risk of developing something like atrial fibrillation. Now, that's not to say it's an overall high risk. Your risk of developing this is low to begin with, but it does increase that risk slightly. And also what we'll notice in some individuals is their heart will grow a little bit too big to the point where the tissue itself isn't as functional as we want it to be. Now, again, not every ultramarathoner is going to develop these things, but in some individuals, this is going to happen as a consequence of this extreme level of exercise. You don't really see this in resistance training as much. Lastly, I just want to touch on the fact that in these studies, they do find that for whatever reason, men are slightly more susceptible to these consequences versus women. So males are about 2 times more likely to have some of these negative consequences. But otherwise, exercise is really, really good for you. But what is the ratio that we're striving for? Do we just completely get rid of cardio? Well, no. As I mentioned before, zone 2 training and some other forms of cardio can have a ton of benefits. Do we only do zone 2 training and no resistance training? Absolutely not. So the literature seems to favor resistance training for a lot of different reasons. I usually will tell my patients to aim for about a 2-to-1 ratio. So almost twice as much strength training versus aerobic cardio training. Now that's a rough approximation, but it seems to be a nice balanced way to do it nonetheless. So in summary, for more extreme people, we're actually talking to our patients about lowering the volume of cardio, throwing in a couple extra rest days. But for the majority of the population, because most people's problem isn't too much activity, we're actually trying to build you back up, aiming for a 2-to-1 ratio of resistance training to cardio. And if you can prioritize zone 2, you will notice a tremendous benefit. So this is even for people who have had events. So of course, if you suffered from something like a heart attack or a stroke, or you have a rhythm disorder, something to do with the heart, you do want to ease into these things and you want to be monitored by your healthcare providers, but it is paramount that you do them. The benefits, even in vulnerable populations, far outweigh the consequences. Most people who suffered a heart attack don't go on to immediately start trying to run ultramarathoners. So for the most part, we're going to want to encourage people to increase their activity levels. I really hope that you found today helpful. I hope there were a couple tips in there that can really guide you to feeling safer during exercise, kind of understand the type of exercises you should be engaging in, and really understand that the risk is there, but only in certain situations, and it's fairly low overall. So get out there, get moving your body. If you like this content, please give me a like and subscribe so I can keep it coming. And if there are any other topics you want me to dive into, please comment those below. Thank you so much and have a great day.